Hi friends, welcome to Ayursure. Today we will discuss various types of diarrhea depending on their pathophysiology. Many medical concepts are hidden in our Indian culture itself. हम नॉर्मली क्या कहते हैं? एक बार जाए सो योगी, दो बार जाए सो भोगी, तीन बार जाए सो रोगी. Here yogi doesn't mean Yogi Adityanath. Anybody who follows yogic lifestyle and if he passes stool only once in 24 hours is considered normal. Bhogi does not only represent a king. This represents we all. Any layman, if he passes stool more than 2 times in 24 hours, that is too normal. But if anyone who passes stool more than 3 times in 24 hours, then there is a problem. This falls under the definition of diarrhea. So this saying goes very, very right. एक बार जाए so yogi, considered very good. दो बार जाए so भोगी, that is too normal. तीन बार जाए so rogi. Now let us systematically learn the definition of diarrhea. Diarrhea may be defined as passing of more than 200 grams of stool per day or passing more than 3 loose stools per 24 hours. This definition is given by Davidson's Principle of Medicine and WHO. But when we say passing of more than 200 grams of stool per day, this definition has a limitation. So what is that limitation? This is applicable for persons who are typically on very low fiber diet. So as per WHO, diarrhea is the third leading cause of death in case of children under 5 years of age. So this is a very important information. बहुत बार ये आप लोगों को MCQ में पूछा गया है different examination में. So diarrhea is the third leading cause of death in case of children under 5 years of age. अगर डायरिया तीसरा बड़ा कारण है तो पहले दो में क्या है? The first two are premature birth complications followed by pneumonia. All the three are preventable. तो सबसे बड़ा कारण for death in case of children under 5 years, premature birth complications. Number 2, pneumonia. Number 3, diarrhea. And all the three are preventable. Now, we will remember the 4 different types of diarrhea based on their pathophysiology with the help of a mnemonics. So, what is that mnemonics? SOME. S-O-M-E. S for secretory, O for osmotic, M for motility, E for exudative. S-O-M-E. SOME. The first, secretory diarrhea. ये कैसे होता है? When the cells of the epithelial lining of the gastrointestinal lumen secrete more water and electrolyte than they can really reabsorb. So this will lead to intraluminal volume expansion. बहुत सारा पानी और इलेक्ट्रोलाइट इकट्ठा हो जाएगा जीआई लुमेन के अंदर and this will lead to diarrhea. It can result from bacterial endotoxins. The most common example, ये भी कई बार एग्जाम में आप लोगों को पूछा गया है, cholera. So the type of diarrhea that happens in case of cholera is secretory diarrhea. And we all know the causative organism of cholera. It is a gram-negative bacteria. The name is Vibrio cholera. And this is very famous for causing rice water stool, or you can say rice water diarrhea. Why it is called rice water stool or rice water diarrhea? Because it contains more of water and electrolyte and a very, very negligible quantity of fecal matter. So that is why the stool that is being passed by the patient looks like rice water. Next, osmotic diarrhea. अब देखते हैं ये कैसे होता है. Osmotic diarrhea results from the presence of osmotically active, poorly absorbed solutes in the bowel lumen that attracts more water to the gastrointestinal tract, leading to poor water and electrolyte absorption, and it will cause diarrhea. अगर मैं आपको 2-3 ग्लास सॉल्ट वाटर विथ हाई सॉल्ट कॉन्सेंट्रेशन अगर मैं आपको पीने के लिए दूं, within an hour you will develop diarrhea. So overdose of certain laxatives such as lactulose and citrate of magnesia or even indigestion can cause osmotic diarrhea. Remember, this type of diarrhea will improve with fasting. Other types of diarrhea, they do not depend on food intake. But osmotic diarrhea, if you stop taking food, the symptoms will improve. This you need to remember. Motility diarrhea, the third one. Motility disorders can cause diarrhea by either accelerating the gastrointestinal transit, for example, post-vagotomy diarrhea, or by slowing down the GI transit, thereby predisposing to small intestinal bacterial overgrowth, which happens in case of scleroderma. The last one, exudative diarrhea. Exudative diarrhea occurs due to inflammation in the gastrointestinal mucosa. So that is why it is also called as inflammatory diarrhea. So mucosal inflammation can occur with diverticulitis, inflammatory bowel disease, ulcerative colitis, or invasive enteric infections such as Shigella, Salmonella, E. coli, or Campylobacter. Inflamed mucosa will not be able to reabsorb water and nutrients properly. So that is why diarrhea will occur. Exudative diarrhea occurs with the presence of blood and pus in the stool. बाकी 3 वैरायटी में हमने ब्लड और पस का मेंशन नहीं किया. So presence of blood and pus occurs in case of exudative diarrhea only. So remember, diarrhea becomes persistent if it lasts for 14 days or more. ये एक बार क्वेश्चन में आ चुका है. जो टाइम फ्रेम है, when we will call the diarrhea to be persistent if it is lasting for 14 days or more. So thank you. Keep watching for more on this topic and more on concept based learning.